Hello, I'm Maria Hall Brown. We are here live at the Emergency Operations Center for the City of Los Angeles, and I'm delighted to be joined by Aram Sahakian, the general manager of this wonderful facility, and people are incredibly busy here. But I need to get some definitions going first. Exactly what happens here at the EOC?
So you're looking at the Emergency Operations Center. Behind you is the hub of the city where we coordinate emergency response and recovery. At this time, we're activated at level 1. And there's 3 levels of activation. Level 1 is the highest level of activation. Having said that, at true level 1, you will see over 100 people in this room behind me. But because of social distancing and because of the 6-foot distancing requirement, we have half of our staff visually joining us through technology that was provided to us from ITA, our Information Technology Agency. So far, so good. It's working. This is one incident, unlike an earthquake where you have your infrastructure in place, you have power, you have communication. It hasn't been interrupted. So we're at a level 1 activation. We have all mission-critical agencies behind me coordinating the many projects that we're working on right now, getting ready for the next 2, 3, 4 weeks.
I have so many questions, but let's just start with level 1. You mentioned there are multiple levels.
Correct.
And what do each of those levels represent in terms of crisis in the city?
It's a level of activation. So a level 1 activation is an incident that impacts the whole region, the state, and the country. So it's a big incident you're looking at. A level 3 activation, on the other hand, it could be a localized emergency, such as a gas leak or a main break and a sinkhole, where we need to activate for that specific one incident, coordinated, and then we'll shut down the doors once we respond and we recover from it. A level 2 activation is in the middle, where you don't need all your mission-critical agencies in the center. You will not, for example, need sanitation or Bureau of Engineering or our mapping agencies. You will need police, you will need fire, and you will need maybe mass care and shelter. So it's a modified level 3 activation in the middle. So, and it depends, it goes up and down. At any time, we could be going from level 1 to level 2 if we feel that the coordination that's happening inside the EOC is sufficient.
There are multiple EOCs within a region. So this is City of Los Angeles.
This is the city's.
How does that differentiate between other EOCs in the region and the state?
So we have the County OEM, Office of Emergency Management. Then you have the Cal OES, which is at the state level. Everything goes through the SIMS process, which is the standardized emergency management system. So there's a path that we follow for resource requests, for communications, for everything. We go through the county to the state, and then it flows back down. As an example, we had requests for the National Guards, for the military, for hospital search. We went through the county, it went to the state, and from there it goes to the military branches that could provide assistance. The ship Mercy, for example, if you want to request a hospital search, you ask the state that I need additional 1,000 hospitals, and at that point they will make the decision if they're going to send an FMS or they're going to send the ship or what else they're going to do to build up our hospital search.
So with something as large as Mercy coming into the Port of Los Angeles, I am assuming that it's not just the EOC that is coordinating. There are multiple agencies that had to make sure that that was, almost an effortless.
Absolutely. And in this case, our governor also made some phone calls to the White House to bring the ship Mercy. But yes, it takes a lot of coordination to receive those requests to the region and to the city.
So police is here,
yes.
Fire is also here.
Yes.
So are they operating separately under the roof, or are you all managing things equally together?
So you have the different branches under the EOC structure. You have an org chart. Under the org chart, you have the law branch, you have fire, you have operations division. Under operations, you have logistics. Everything goes through logistics as far as resource ordering. Then you have mass care and shelter. Recreation and parks is part of mass carrying shelter. For example, the rec centers right now that we've activated for the homeless shelter population to shelter the vulnerable population within the homeless, that's the rec and parks operation. There's other teams from the mayor's office, different task forces that are dealing with the vulnerable population, the seniors, the homeless population. It's very structured. It seems complicated from outside, but as you dig deep, it's a very structured process. And I don't want to brag about it, but LA and California, we're the best at it. I mean, we wrote SIMS, the Standardized Emergency Management System, was born in California, and the NIMS, which is the National Incident Management System, is based on the SIMS. So we're extremely good at it.
You are extremely good at it because we do have a wide array of emergencies that impact a large group of people. Earthquakes, fires, whatever. But when it comes to public health, this has to be something that really called for completely different approaches to what you do.
Absolutely.
Did you have to just start from square one, or were there other things in place that you were able to fit into this?
We didn't start from square one. This is not the first pandemic that we've seen. You've had the H1N1, you had the Spanish flu, you have the flu. So we have history. We have historical data that we look at. And also I need to mention that public health is under County of Los Angeles, so they are the experts, so we do follow their lead when it comes to recommendations on the health topics. It's nothing new. We had a pandemics annex, for example, so the first thing we did is to pull that pandemic annex and ensure that we align it with a COVID-19 pandemic perspective. So we didn't start from ground zero. It is different. On a normal day, you will not see people behind me with face masks on. We will see a packed room, but you will barely see people behind me. You know, each station has one or two people. It is a novelty. It is a novelty, and there is no remedy for it yet. The best remedy is to stay put, and that's the order from our mayor, safer at home. That's the only way we're going to be able to control it until it dies down, until we build immunity, until there's a vaccine or medication for it.
We met, I don't want to say at the beginning of this experience, but we actually had a chance to speak back the first part of March. So much has changed, both in the world at large, but I am sure in how you have mentioned how this is going on. What are the major hurdles that you have had to face in order to make sure that, although this room is not full, it is fully functional, whether remote or not, different issues coming into your realm that you have to decide upon? What have been the major hurdles in just even the last few weeks?
Protective equipment, that's the number one. Logistics, basically. We're having a hard time finding and purchasing the PPEs that we need. And not only for the medical professionals, I mean, they're also in a very tight spot. The N95 masks are very hard to find now. But even surgical masks, even gloves and goggles and thermometers. Yesterday we looked everywhere for thermometers. So we're going globally. We're going through our business operations center to reach out to vendors. And we're thinking outside the box. For example, the mayor's office right now is working with the garment district, and I had my mask here somewhere, so it's a cloth mask that they started manufacturing. And Dr. Ferrer today said that unless you're a medical professional, you don't need an N95 mask. I mean, to the point where you can make even your own. I mean, we are very short on these masks. So every professional N95 needs to go to the medical industry, the doctors, the nurses. Obviously, all our first responders, police, fire, paramedics, they also need to be protected. So we're looking at other criteria, what else we can use to ensure that we have the supply for everybody.
You speak about trying to be innovative, like you were just speaking about masks, but there have been a number of ways you've had to be innovative. You mentioned parks as shelter locations, and now even the convention center. I mean, is anything off the table at this point?
Nothing's off the table. And we're using the convention center for a hospital search, 250 beds. Obviously, there's more capacity at the convention center. Hotels, motels for isolation. We're using trailers at the homeless shelters, again for isolation, mobile home trailers. Absolutely. Anything and everything that we can get a hand on. And experience comes into the picture here. Like you said, we've seen our share of disasters and emergencies, from fires to floods. I mean, the 17 of the largest 24 fires in California history were recently in the last 24 months. So unfortunately, you build good experience, good lessons learned, good after-action reports from these incidents. And it teaches you. It teaches you how to respond to the next one, even if it's a novelty, even if it's a curveball coming at you, you get used to it and you know what to do.
Let's expand upon the convention center as a hospital space. I mean, Mercy's in the harbor, and that is a overflow hospital space for people who are not suffering from COVID-19.
Right.
And the convention center, is that going to be for patients who have nominal problems, or where is that fitting into the whole plan?
So the initial plan is to, again, just like the Mercy, take their patients from hospitals that don't have the COVID-19, they have mild symptoms, so we can empty up very critical emergency room and beds within these hospitals. Now, having said that, anything could happen. The professionals, the healthcare professionals at these centers will make the decision what to use these centers for. But right now, the convention center is designated, like the Mercy, as a non-COVID center.
A non-COVID center, because you think about so many people, although completely affected by this pandemic, there are women having babies, there are accidents where someone has broken a limb, there are people going through cancer treatments, there are very serious issues with people beyond those that are suffering through this horrible virus.
Absolutely.
So are those people in safe space too? Are they a priority for everyone in this whole world?
Every Angelino is a priority. No matter what they have, we're going to try to help and assist every single Angelino. We will prioritize, obviously, and some of these hospitals are being designed, again, to make space for the COVID-19 patients within the intensive care units or the other hospitals.
Have you noticed that there is a receptive quality to those, the unhoused? Because that's a problem that Los Angeles has had well before any of this took place. Have there been good inroads made with the unhoused to make sure that they are aware to the capability that they can understand what's happening, and are they responding?
Absolutely, and you know, this is on top of our Mayor Garcetti's list. It's very dear to us too, and right off the get-go, day one, we had HOPE teams going and walking the streets, identifying the vulnerable population within the homeless, the elderly, and the ones with a chronic illness, to ensure that we get them off the street into shelters to protect them. So the answer is yes, absolutely.
You've spoken a little bit about how this is all working in coordination with other agencies locally, but I know from our previous conversations that you actually look to outside communities too to see what has worked and what has not worked. Has that been a huge impact on what you decide to do here?
Not only outside communities within the U.S., we also look at globally what's happening. Yeah. And in some sense, we're lucky that, and I hate to say this, that we were able to observe what's happening in China and some other states that are ahead of us, that are ahead of the curve. And accordingly, that gave us a good picture where we're headed, and we can better prepare because we know what's coming our way. Yes, so on a daily basis, I speak to my colleagues, the big city emergency managers. I'm part of a group of 15 big cities that we meet twice annually to discuss these exact things, to discuss the emergencies, the responses. And on a daily basis, I connect with them. We discuss hospital search. We discuss lessons learned, what's working, what's not working, mental health. That's after I leave here at 8, 9 p.m. My last 2 hours before midnight is basically comparing notes with my colleagues. It's 3 a.m. for them, in some places, but we're all on the edge. We all want to make sure that we're ready. I mean, we live for these moments, right? We prepare for these moments.
So what is the hierarchy of the decision making? Because you have a lot of voices, and especially in a city that has so many needs as Los Angeles and has so many diverse voices. How are the ultimate decisions being made? Is it from the local level to the city level, the county level, and then the state? Who answers to whom, and who has the final say?
It depends what's the issue on hand. So, for example, if it's a health issue, county health is the lead.
Okay.
They will make all the decisions on that. If it's a tactical mission, a tactical issue at a local level, then there's an incident command system we follow, and collectively we decide basically what's the best step. So you have teams brainstorming, discussing the plan, putting it on paper, playing the what-if game, and ultimately the incident command structure will make the decision.
The what-if game seems to be almost impossible with this particular issue because, not only do you have to be prepared for things that you are aware of, but you almost have to be a prognostician and think about what could possibly happen. So have you been prepared for something that no one could have expected, or how are you deciding what you should be prepared for a week from now, 2 weeks from now, a month from now?
So as an emergency manager, you prepare for the worst-case scenario.
Which
Unlike
is?
some other professions, that are more optimistic, our job is to make sure that, again, that curveball that's coming at you, you're ready for that. So the worst-case scenario for us would be, hospital surge, right? I mean, you run out of hospital capacity, that's the worst thing that could happen.
Sure.
You run out of ventilators, that's the worst thing that could happen. So we plan for that. We work with the county health professionals, the medical health professionals, and our brothers at county OEM, our brothers and sisters at county OEM, to calculate how many beds is needed to surge, going through the ready med system. So it's a collective effort. It's not just us. It's the whole emergency management family in the county, statewide, looking at all these general managers. And although you say the what if it's almost impossible, it's not. We say, what if we ran out of hospital space? What if the community spread is spreading faster than what we'd like to see? And we address those issues.
Well, you also are dealing with the private sector, I would imagine. I mean, you see headlines from across the world about, ice rinks in the UK being used as mortuaries and all of these kinds of things. So have you created a conduit of relationships with
we have
private
our Business
sector?
Operations Center, which is at the corner way down there. That's our BOC.
Okay.
And what they do, 80% of the resources are on the private sector side. It's not with the public sector. We need to hold their hands not only in response and recovery, also preparedness, mitigation. So during normalcy, we're constantly developing new relations. Ensuring that we know each other, who's doing what, the Chamber of Commerce, the Bureau of Tourism, everybody and anybody that's out there, even small businesses. We have over 500,000 small businesses that we deal with, and we want to ensure that they're ready for the next novelty or the next unknown, right, the next incident. I can tell you that our BOC right now is as busy, if not more busy, than the main floor right now, right here, because we're constantly communicating with private vendors globally to ensure that we bring in the supplies that are needed for the grocery sector, the supply chain, the grocery sector, fuel sector, water, medical, pharmaceutical, absolutely.
Well, and I know that they're being polite and somewhat quiet for our benefit.
They are.
But in terms of who's in this room, because this is quite a dramatic space to begin with the, all of the media on your walls and all the different liaison stations here. So what are the different sections in this room?
So you have the logistics branch, law branch.
You got to make sure that you...
I'm looking there so you can hear me. Okay, sorry about that. So you do have the civilian agencies, from Department of Transportation to Sanitation to Bureau of Engineering to Building and Safety those are critical departments for any mission, usually any incident. Then you have the first responder agencies as far as police, paramedics, the first on the line, and that's the law enforcement and fire. Then you have outside agencies. For example, you see the military branch behind me,
okay.
right? And we brought in basically the National Guard. So, and if we need them, in case we need them, they're extremely knowledgeable on the process to summon DISCA, which is Defense Support to Civilian Authorities, and that's the Mercy is part of that. So you have 15 agencies that are here, in addition to outside agencies that we bring in, such as MTA. MTA is another agency that they have a table here. LAWA, Los Angeles World Airports. We have County Health. County OM is represented here. We have the Port of Los Angeles. The list goes on.
The list goes on.
Yeah, level 1 activation, basically, we could have up to 60, 70 agencies. If we need them, they will report to the center.
Okay, and I'm going to bring you back a little bit to the
Okay.
microphone so that we can make sure that we hear all
Sorry
your
about
interesting
that.
information. But you did bring up something. Transportation is a critical component of Los Angeles. You know, there's a lot of people who are not using their private vehicles that, you know, need public transportation. I know that that's been a priority.
Yes, yes.
So there's been some adjustments made there, and is that
I
something?
mean, as far as adjustment, I can tell you number of accidents have gone down.
Really?
But number of severe accident has gone up because of the speeds. So I can tell you, for example, Department of Transportation yesterday, what they did, they adjusted all the signal timing to nighttime signal timing. And nighttime timing basically does not give you the progression, the green light, so you don't speed 65, 70 miles per hour. So they're different taxis. They're also thinking outside the box, different tactics. The only routes that are being preempted, they're the MTA bus routes, because those needs to be synchronized so the buses make their schedule.
See, it's all of that information that I think that the public, you know, understands, that you know that maybe there's some reasons behind it that are not necessarily known at large. But one of the things that I'm curious about is, where do you get your information? I mean, you are on the cutting edge, you know more than the headlines, you know the backstory, you know the rationale and the reasons, but where are you getting your information?
So we do have a Joint Information Center, a regional JIC, we call it, Joint Information Center, that's basically monitoring the whole region and the globe, and collecting information, vetting it, ensuring that it is correct information, then funneling it down to the emergency operations centers throughout the region. We obviously also follow the CDC, the World Health Organization, LA County Public Health, the news media. We follow you guys. Sometimes we find out from you guys before anybody else. You know it before anybody else. So there's a process for that, but the body that really gathers all this information and ensures that it needs to be vetted. You need to make sure that it's not a rumor that's floating around. It's our Joint Information Center.
Something that is this crisis driven, I also imagine, will have a point in which there's an exhaustion factor. There's an exhaustion factor with your staff, there's an exhaustion factor with the information, and there's just an exhaustion factor with people not being able to necessarily work with it the way they have at the beginning, or take it as seriously. Are you worried about that too, or are you noticing that everybody is staying the course and soldiering up?
Very good question. And more than the exhaustion factor for this incident is the fear factor. There's a mental fear factor that's uncomfortable, I'll be honest with you. I don't think the exhaustion factor has sunk in, because we're not there yet. It's not like an earthquake. The pace is a slower pace right now. Like I said, the biggest issue we have, is the PPE logistics. But in addition to that, the projects that we're working on. So the mobile testing sites, 5 of them, we're testing thousands of them. This also is one of Mayor Garcetti's program, and I believe Jeff Gurrell spoke on this program at Channel 35, if I'm not mistaken. You have the ambassador program, which is disaster service workers, ensuring that people are following the safer at home directive that our mayor issued. You have the shelters with the homeless population. So we have the senior meals program. We're distributing over 11,000 delivery to seniors, and that number, last I spoke with Laura Trejo, the director of Department of Aging, could climb up to 25,000, right? But those are not like there's a collapsed building and you're trying to save people from under it, or blocks are on fire, right? It's a slower pace. So I don't see the exhaustion. One concerning thing is that I see this going for 2 months, and hopefully, God, I hope that I'm wrong, and that will at some point get to you, especially if you become a 12-hour operations, 24 hours a day, that could become exhausting. But it's the fear factor more than anything else right now that's weighing down on people. Families at home, they're worried about that. A lot of people here, they have kids at home, they have elderly at home. So although they come here, they work, they're dedicated. When they go home, they want to ensure that they're in a safe environment at home, so
Absolutely.
they can respond here. They don't bring anything here, and they don't take anything away from here.
Well, one of the best ways to eliminate fear is information. And I know that you've made an enormous effort, along with the mayor and all of the organizations you've dealt with, to get the information out there. So the websites that people can rely on for vetted, pertinent, up-to-date information.
So COVID-LA at lacd.org, that's one of the websites that we have. We have a couple of other websites too, and we can give you those websites so you can post them online.
Wow.
Yeah.
I cannot thank you enough for all of this amazing information, and your wonderful staff and those that are working with you. And I really want to thank our ASL interpreter, who I hope has been able to understand what I say, Rick Pope. He's been spectacular as well. And if you could give one message to the people of Los Angeles regarding the EOC, what would you want them to know at this moment?
We are here ensuring that we are coordinating the response and the preparedness activities for Angelenos, for our city. We feel confident that we're going to get through this. I have no doubt in my mind, but we also need their help to really stay home. Help us with this endeavor, because it's the only tool we have. The only tool is stay put. Hopefully it'll die down, or the curve will start going down, and then we'll go back to normalcy. So help us help you.
And I believe you are an optimistic man, so I believe that you feel that that is going to happen.
Absolutely. Absolutely.
All right. Well, I'm enjoying speaking with you. I wish we have an opportunity to chat at a later date that is something not as dramatic, but thank you so much, Aram, for being with us.
I appreciate it. Thank you.
All right.